Good afternoon. I'm here with Wayne Moorehead at AMRPA's Fall Educational Conference and Expo here in Dallas. Wayne just spoke as the patient perspective speaker for this year's conference, and I'm here to sit with him and talk a little bit about what his presentation was about. Welcome, Wayne.
Oh, thank you for having me, Chris. I appreciate it.
All right, so you just gave a great presentation about your experience at Tier Memorial Hermann, and it was about your experience in inpatient rehab, right? So can you give a little bit of background as to why you were in inpatient rehab?
Sure. I'm a quad amputee. I got sepsis in 2018, and for some of your viewers that don't know, sepsis is a disease where your body starts shutting down, basically because you're fighting off so many diseases and infections. It doesn't know what it's doing, so it kind of shuts down all your extremities, and it's bringing all the blood flow and everything to your vital organs. It's trying to keep you alive. So, everything started shutting down, and that was in 2018 in July. I ended up having my amputations in September 11th and 13th of that same year. And right after that, I went inpatient. And right after my amputations, I was an inpatient for 3 weeks. And then I had another rehab for another 2 weeks of inpatient again.
Right.
Yeah.
So can you talk about a little bit about what the impact was of medical rehabilitation on your recovery?
Oh, I don't know how people do it without it, because I've heard the stories of people, they just sent me home.
Yeah.
I just don't know, because as a fresh amputee, you have no idea what's happening. You don't know what's out there. You don't know what you need to do. You don't know what you don't know, if that makes sense.
Yep, absolutely.
I've heard that saying lately, you don't know what you don't know. But it just... The inpatient stuff taught me in the beginning, basically, how to go back to living a close to normal life as possible.
Right.
How to roll over in a bed. I had to learn how to do that without injuring myself. How to lean forward and get up. How to not use my hands, but use my elbows for things. The inpatient rehab really started the process of my recovery. Without it, I don't think I would have ever made it this far.
Yeah. And what role did your care team play in your experience with medical rehab?
Oh, care teams are so important. I can understand the individual therapy and stuff like that, but I'm glad I came into this new system and this new way of thinking that they work way better. So I'm loving that. Having a medical doctor at the time and a physiatrist or a PM&R doctor also at the time, just coordinate my care with the PT and the OT and the speech therapist, which I didn't need to do, but I did do neuropsych and that kind of stuff, because it's all involved in your process, your 3 to 5 hours a day of hard rehab. And everybody gets to say their little piece in their meeting about you and where you're going and what how far you've come and what you need help on, so they can focus and change what needs to be changed. So just having a good care team behind of you is so important.
Yep. And I guess the last thing I'll ask you is, generally speaking, how did your experience at Tier sort of shape your perspective of medical rehabilitation?
Oh, man. Medical rehabilitation, like I said earlier, I don't know what I'd do without it. But you need a good quality facility, not just a team, but a quality facility that, like I mentioned earlier, from the CEO down to the people that clean your rooms, because there was a lady that would come in and tidy up the room and clean up. And I, at one facility, and then when I went to outpatient, she would also be working at the outpatient facility. Right. And she would stop and talk to me and just, help bring back memories of what was going on and just keep the community effort going. And I thought that was so important, and then at the time when I was inpatient, the CEO would walk around the floor sometimes. And our new CEO is great. She's treated me so well and so nice. So it doesn't matter what part you play in the rehab. You don't have to be hands-on, but just knowing you're there and knowing that whatever you do helps, it's really, really important and really good.
Gotcha.
So,
well, thank you so much for taking a few minutes to talk to me, and thank you for being here and helping to kick off this conference with such a great presentation.
Oh, it's my pleasure. I should thank you for helping to get my little bit of a story out there and tell your folks a little bit about what it's like to be a quad amputee, and what it took for me to get here. I appreciate it so much.
Absolutely.
All
Well,
right,
it was
appreciate
great
it, Coach.
talking.
All right.
All right.